Preschoolers are 3 times more likely to suffer from upper respiratory infections than those that stay at home. This not only affects the child, but of course affects the parent that may have to stay home with their sick child. What if there was something you could do or give your child to help reduce the incidence or symptoms of upper respiratory infections? The good news, there is. Dr. Nigel Plummer, an expert in probiotic research and development, has published over 100 papers on this topic and has been key in the development of Genestra's HMF Fit for School. Dr. Plummer, can you tell us about the role of probiotics in upper respiratory tract infections?
Yes, well, as you say, these are very common. And kids between 3 and 7 years of age get between 3 and 8 episodes, typically, of coughs and colds every year. And what we were looking to try and do, probiotics have been known to have an impact, because they're part of our microbiome, known to have an impact on our immune function. So what we did with this trial, we took kids who were between 3 and 6 years of age, and we put them on this probiotic every day for 6 months throughout the winter period. And we measured the following symptoms. So we measured sore throat, cough, sneezing, blocked nose, and runny nose. And what we found at the end of that 6-month period was that the children who were on the probiotic group had 50% less symptoms over that 6-month period than the children who were not taking the probiotic. More than that, once we then looked at the incidence, so how many times during that 6-month period did these kids experience symptoms of coughs and colds? That was decreased by 30% in the probiotic group. So both in terms of duration of coughs and colds and the incidence of coughs and colds during that 6-month period, probiotic had a major impact. Then we looked at some other outcomes that weren't really related necessarily directly to health, and we measured absenteeism from preschool. And what we found was that the probiotic group, again, had 30% decreased absenteeism over that 6-month period. Now, given that when kids are absent from school, mum has to take off time, right, or dad has to take off time, or somebody has to take off time, that was a major impact, and it had a big impact, and it resonated with mothers when they heard this. But it also there were other benefits that we saw as well. We saw a 40% decrease in visits to the doctor, which was because the kids were not getting coughs and colds. Then obviously there was a decreased visit level to the doctor. And really importantly, from my point of view, because we were having 40% decreased visits to the doctor, we had a 40% decreased use of antibiotics during that time. So an excellent trial, and one that showed, if you like, an expanded area where we should be looking at probiotic usage. So this is, if you like, enhancing the immune system generally, and if you like, over a long period of time.
So could you describe a possible mechanism on how these probiotics are helping?
Well, we aren't sure exactly, but what we know is that our microbiome has an impact on, if you like, priming our immune system throughout our lives. And probiotics, as we say, are simply the most beneficial components of our microbiome. So what we think is going on is that the probiotics are priming our immune system to function in their most basic way, which is to prevent us getting infections. And that can be by, if you like, increasing the white cell activity, or it can be increasing the white cell numbers. That kind of detail we don't really know yet, but we're looking at finding that out.
This is really encouraging. Would this be something that a parent could be using with their child on an ongoing basis to improve their health?
Yes, I think this is one area now where what we're seeing is that probiotics have this effect, and our trial is not the only trial that has shown that probiotics generally have an impact in terms of decreasing coughs and colds. So there was a study that looked at 20 other trials looking at probiotics in decreasing coughs and colds in both children and in adults, and the average level of decrease was 30%. So probiotics are now being viewed as being a very effective mechanism for increasing general health, and especially general immune health across the board.
That's great news. So children are notoriously picky. How would you give this probiotic, such as the Genestra HMF Fit for School probiotic, to a child?
Well, this is because you have kids and kids from 4 to 16 years of age don't really want to take capsules, don't want to take a typical tablet. What we have here, we've made this into a chewable form. So it's a chewable form, it tastes great, and so kids, it's often hard to stop them taking it rather than start them taking it. So it works very, very well.
So chewable and tastes great.
Tastes great.
When looking for a clinically researched probiotic, such as HMF Fit for School, ask your healthcare provider, your pharmacist, or visit your specialized health food store, or visit soroil.com.